Okay, so my name is Alexis. I'm going to be doing a health and social risk assessment on Lorena Orozco. So, first off, it's going to start with your personal health history. So, is there any childhood illnesses or immunizations that you remember or medical problems that you had when you were younger?
I used to get a lot of fevers, so I would be in and out of the hospital a lot when I was like, I want to say months old.
And that kept happening until you were what age?
I want to say maybe two.
Till the age of 2. And then, is there any surgeries that you have had ever since you were younger until the time of now?
No, I have never had any surgeries.
And then, have you had any other serious hospitalizations in the past?
Serious hospitalizations? No, I don't think so.
Okay, so you've never been like rushed to the hospital,
No.
but you've been hospitalized for like little things like sicknesses.
Yes.
And in what year was that? If you remember, kind of like the roughly of the year.
I want to say they started in 2017.
Okay, and perfect. And have you ever had any blood transfusions for a serious accident?
No.
And then now this is going on more into like a spiritual assessment. So, is there anything that you say that gives you hope or like motivates you?
Um, I'm not sure.
Like it can be anything. Like it could be like friends, like family, or
I
like
think just
just.
family in general, just because you try to do better for yourself and just kind of make your parents feel proud of you in a way.
And then is there any sort of like religion that you've grown up with?
We've grown up in the Catholic religion.
Catholic. And for your personal spiritual practice, like with the Catholic, do you find yourself like praying a lot or going to church?
So I'm not the type to go to church often. It's usually just more of like on specific events, but it's usually just more like in home praying.
And then have you seen any effects that religion has had on like your healthcare?
Yes, just because when I was little that I got glitter stuck in my eye. I was going to get surgery for it, but then my grandma said that she had been praying a lot like the night before, and the next morning when I went in for surgery prep, they checked my eye one more time and the glitter had came out of my eye onto my out of my cornea, so they were able to just get it out with a Q-tip.
So would you say that you do believe in like miracles and stuff like that because of through prayer?
Yes.
Perfect. And then moving on, this one I'm going to talk more about any medications. Do you take any like over the counter medications or have any prescription drugs?
I usually take a lot of like ibuprofen for like pain, and then I believe the other one is like the I don't know how to the acetaminophen. I don't know how to
Oh,
say that one. Yeah.
yeah, acetaminophen.
Yeah.
And do you find yourself taking those like daily, like weekly, or just like for like headaches and stuff?
No, it's usually just for more when I do get like I want to say like colds, so it's usually
Mm.
not that often.
And then do you have any known allergies to medications that you know of or any reactions you've had to them?
Not to any medicines, no.
And then now this part's going to go more into like your health habits and personal safety. So, for when it comes to exercising, do you find yourself that it's like no exercise, like mild, where it's kind of like walking, or like occasional vigorous, where it's like you're working a lot and you're moving a lot, or you're doing like 4 times a week?
Yeah, I would say like mild and just like with the working wise, just because
Okay.
we do walk a lot at work, so I feel like that's a daily thing.
Okay, and then when it comes to diet, are you on like have been diets, like medical diets, whether it be for like a keto diet or hypertension or like sodium? Any
I'm
specific
not on any
diets?
specific diets right now, no.
And then caffeine, do you consume caffeine on a daily basis?
No.
And how many meals do you say that you have on average each day?
one or two.
One or two?
Yeah.
Is there a reason that it's so limited instead of to like the three?
I would say just because I wake up late, and then
Wake
on
up
top
late.
of that, I'm just be honest, I usually just forget to eat.
Okay, so like
Yeah.
just like if there's no like work
Yeah,
life with the balance,
no, it's not
yeah.
like a specific reason. It just kind of happens.
And then when it comes to alcohol and drug use, do you drink alcohol?
Yes.
And would it be like an often drinking or like specific times or how many drinks per week?
Usually just specific timings. It's not often at all.
And then have you ever found yourself experiencing like blackouts or binge drinking or driving after drinking?
Blackout, yeah.
Blackouts, yes.
Yes.
Has it been like a recurring thing or like just like one time
No, it's
thing?
just like a one-time thing.
And then do you have any tobacco or cigarette use?
No.
No. And then do you currently use any street drugs like whether it be marijuana?
No.
And then this one is getting a little more personal too, just so you're aware. It is going into like, are you like sexually active? Are you trying to get pregnant? Or if you are on any oral contraceptives for birth control?
No.
No.
Okay. For all of it.
And then is there any illnesses related that you have find yourself that you want to speak with a provider about or anything that you're concerned about?
No.
And then this part goes into personal safety. So, do you live alone or have any worries about vision or hearing loss?
No.
No. And in the future, do you think, would you like any information on preparation for these, or do you not feel like they're a worry for you?
I would say I don't think there would be a worry, but if anything does come up in the future, then it's always good to have information.
And then this one goes more into your mental health aspects. So, do you say that stress is a major problem for you?
Yes.
And if so, how do you see it as being a problem? Like, is it work, school, like family?
I honestly would say I want to say like family, and maybe I don't think too much like work. Maybe the work does play in a little bit, but I don't think it would be too much.
And then is it more of just like sometimes it's just conflict, or is it like a daily thing?
I think it's more just conflict. I think it's just because with my parents in certain situations, but it's usually not too bad.
And then when it comes to stress, do you ever feel depressed or panic when you're stressed or find yourself having problems where you're eating less or eating more?
Yes.
And then do you find yourself crying frequently or having thoughts of harming yourself?
No.
And then this one is going to go more into your sleeping. So do you find yourself that you have trouble sleeping
Yes.
or a bad sleep schedule? How would you say your sleep schedule is?
I think it just depends. It comes around like certain timings where I just can't sleep at all. So I'll be up until like 4 in the morning, and I get maybe like 4 hours of sleep, maybe less.
Oh, okay.
Um,
So it just depends.
yeah, it just depends, but usually it's pretty rare. I think right now I've been pretty good on the sleeping like my full 8 hours.
Okay, good. And then have you ever found And then so going again into with the counselor, have you found yourself needing to see a therapist or a counselor?
No.
And then what was the age of your onset of menstruation?
When I was 14.
14. And then for your last menstruation, do you remember roughly, was it like mid-month, end month, or beginning?
It was, I want to say, I'm sorry, I have it right here. It was at the beginning of the month.
Beginning. And would you say it's a pretty regular cycle?
Yeah, it was regular.
And then do you ever find yourself having problems with your periods where they're irregular? Or have you had any pregnancies at all?
No pregnancies, but I have had irregular.
Irregular?
Periods. Yes.
And then Have you had any infections with your bladder or kidneys, or seen any problems with you urinating or any blood in your urine?
Not that I know of, no.
And then do you find yourself having any pain or irritability when you're on your menstrual cycle?
Pain, I want to say sometimes,
Yeah.
not always.
And then this is going to be going into more of like any other issue you have. So have you had any skin or back or any of the body systems, like any issues?
No, not that I know.
And then now this one's going more, so that was the health assessment. This goes more into the social risk assessment. So for your economic stability, it's going to go more into like your job and how economically stable do you feel in the position you are, or do you want to improve?
I would definitely want to improve, just because I would say that I am, I guess, a little bit stable right now, but there's definitely room um, to look for a better job.
And then when it comes to your education access, do you feel like you've had a good overall access to education? Have you gone to high school and some college?
Yes. So I would say education has never been, well, there's never been a problem for me to be able to get any sort of type of education.
And then did you say you did have some college for how many years?
Yes, I went to college for 2 years.
Mm. And then when it comes to your healthcare access, do you feel like you have a good insurance, and what insurance do you have?
I would say good insurance, just because I feel like I have never had any problems with it. Um, we're under I want to say Medical Molina Healthcare.
Perfect. And have that been the only one that you've ever been on?
Yeah, I've always only been on Molina.
And so ever since you've had it, do you feel like it's been giving you good opportunities to get like healthcare that you need, like when it's needed emergent and any crises that you may have?
Yes.
And then going into more of like your neighborhood, do you feel safe in your neighborhood and in your housing situation?
Yes, just because I feel like we've never had any issues in the area.
Perfect. And have you lived in the same neighborhood, or have you switched neighborhoods?
We've switched neighborhoods, I want to say once.
And lastly is your social and community. So do you feel that you have a good like social background and like people that you can really go to and rely on that you've built through, whether it be like work or school, friendships?
Yeah, I would say I feel like I have a very, maybe not a long list, but I do have a couple people on my list that I'm very reliable with, that I can go to if there's any ever a problem.
Okay, perfect. That concludes the health and social risk assessment. Thank you again for your time.